Hi guys, it's AJ here. I just have, I don't know, a little rant, a little piss off factor. I went and saw my chronic pain doctor on Friday, one who I have been seeing for a year now. And she knows my meds, knows my history, and knows that since the very beginning I've been concerned about my use of Norco daily. And for the longest time, I would not take them until my pain was there, until it was enough that I didn't and couldn't make it through anymore. So I took my pain meds. And then I would take halves. I would take half of a Norco 5, and at bedtime I would take the full 5, just because night times were a little bit worse, and they still are a little bit worse. But when she was asking me months ago about my pain meds, my usage, and my flare ups and different things, and this was the beginning stages of my RSD, to where I didn't fully understand it. I didn't have all the information that I have now, and that I continue to still gather and still get information. But she told me months ago that I needed to take my pain meds regularly and consistently to help my RSD flare ups. I understand that now, but months ago I didn't understand that. So, months ago, I didn't take my pain meds as regularly as I do now. So I go to my pain doctor, and I'm in the waiting room, get called to the window, and I get piss tested. It's not the first time, but apparently now I will be piss tested at each visit. So I had to piss in a cup, and mind you, that's no fun when you have one hand in the stupid little jug is sealed tight, and then your little pee cup is safety sealed. Yeah, that's a joke. I'm on the floor with it between my feet trying to untwist it, so that was a humorous event in itself. And then when I turn in my piss test, my nurse comes out and gives me an iPad mini with a 25-question psychological evaluation, asking me about my pain and my activity as to what I can do versus 2 weeks ago. Is it difficult for you to do your daily activities without pain completely? Is it difficult for you to maintain social activities? Yes. I swear it was like very difficult, very difficult, very difficult, or it was like enable, enable. So I'm constantly clicking on the side of the mini that was non existent, because I can't do all the social activities that I once did. I can't participate like I did. And the only question that was a positive, absolutely not, was the one where it asked if I had considered taking my own life. No. Taking my limb off at some point in time? Yeah, that was a thought. So as I'm sitting there, and I'm just going, oh my gosh. And then she comes in and she talks to me about my pain meds and my pain usage, because the state of Michigan has sent her an itemized list of all the pain meds that I have taken. And she is asking me about this doctor that prescribed me Norco 10s, quantity of 30, back in January. And I'm looking at her going, I don't know who that doctor is. And she wasn't arguing with me, but she said, well, I'm sorry, but this says on this day you filled this prescription, this doctor signed it, and it was for this quantity. So I'm looking at her going, I don't know who that doctor is, but I went back, and that was the date of my shoulder manipulation. And I said, well, it must have been my orthopedic surgeon. And it wasn't his name. I said, so maybe it was his intern, maybe it was the anesthesiologist or whatever. So I've been seeing this pain doctor for a year. She's the one who diagnosed my RSD. So for 16 months, I have had 4 write me prescriptions for narcotics, and I take Norco 5s, and now I'm taking the Norco 10s since they've done the shoulder manipulation and my spinal cord stimulator. So temporarily I'm on Norco 10s. So I'm getting lectured on how 4 doctors have written me scripts. One is my primary care, who has written me 1 script for Norco, and one was my doctor that has done all of my nerve blocks, that did my spinal cord stimulator. So of course he wrote me a pain script for Norco. And then the other was my orthopedic surgeon who did my shoulder manipulation. The rest, my pain doctor. State of Michigan is putting me in that classification that I am pill-seeking, pill-popping addict. Like, what the fuck? I'm sorry. Pardon me, but really, I'm not an addict. I'm not pill-seeking. I'm not pill-popping. I have chronic pain. And I'm sorry that the state of Michigan feels that over the course of 16 months since my accident, 4 doctors have written me scripts for pain pills. 4. 2 for surgeries, my primary care, and my pain doctor. I don't think that's a little excessive. So yes, do I agree with this control crap that is going on? No, I don't. I think that chronic pain users are getting abused. I think that we as patients have a right to have our pain alleviated. So stay tuned for part 2 because this is a little lengthy. So we're going to continue this and go from here. But I just wanted to touch base and say that here the JGF family supports you and supports your pain medication management, no matter what it is. So thanks everybody. Have a great night. Take your pain meds because you know what? You need them and you are totally entitled to them. So good night, and I'm sorry for my rant and my F-bomb, but sometimes it just works. And we'll touch base again tomorrow. Good night, guys.